This is the Mandibular Lateral Incisor. So this is the right side again, universal number 26, Palmer 2 and international 42. Some general information about this tooth is that it's rare to have any root division. It's generally just one root, but it is a little bit more common to have two canals within this one root. If you look at it from the facial, there's a slight angulation to the incisal edge. So it says it may slope cervically towards the distal, but I guess that doesn't mean that it's always that way. And this tooth here, this would be the mesial and this is the distal. So it slopes down distally, and the mesial half is not symmetrical to the distal half. And you can see when you look closely at the crown that that's true. The distal incisal angle is a lot more rounded than the mesial. So the proximal contacts are located in the incisal 1/3, close to the incisal edge. And again, these are in the same general area on the mesial and the distal. This is the cingulum. It's slightly distal to the bisector line. The mesial marginal ridge is slightly longer than the distal marginal ridge. And the fossa are barely visible on this. It's extremely smooth, just like the central incisor. So looking from the proximal, again, taller than it is wide. So the incisocervical dimension is greater than the faciolingual dimension. Height of contours are located in the cervical 1/3. So that's here and here. The facial is slightly higher than the lingual. And the incisal edge is located on the root axis. Again, the root surface has a obvious indentation on the distal and not as much on the mesial. So it has a little bit of an indentation, but it's not as pronounced as it is on the distal surface. There is a slight twist to this mandibular lateral incisor crown. It appears twisted. The distal portion of the incisal edge is slightly lingual. So this is the distal edge here, and it's slightly curved inward. And the cingulum appears slightly distal from this angle as well.